So, Julie, thank you for coming in today. Would you mind just telling us a little bit about your story at Revitalize?
You bet. So I've always struggled. I had PCOS and have had struggles with my hormones, and they've told me that over the years that there's no treatment. And now that I've started going through menopause, the symptoms got very severe to the point where I thought I had COVID. And I called my older sister and she said, if that's not COVID, welcome to menopause. So I tried the traditional approach and tried to go to my regular doctor. And if your results or your labs fall within a normal range, there is no treatment and no answer. And that's when they broke down and said, I've got to find somewhere that will treat my symptoms. And then my friends worked at Revitalize and referred me to here, and they specialize and know a lot about PCOS, where your normal physicians don't even know how to treat them. So that's what I started here a year ago today, and I've lost 43 pounds and then down the lowest weight as an adult. My hormones are still all over the place, and they're able to adjust those every time we meet to satisfy the different changes in what's going on, and have had great results, and I'm very happy with the treatment that I've gotten, how personalized, and the knowledge of the company and how comfortable they make you feel as an individual. Like, I knew what to ask my doctor to look for, a regular physician, whether what blood tests to run or what I struggle with. Even with that information, if your results fall within the norm, they refuse to prescribe or treat any of those symptoms. And I've been told by different doctors that it's just your bad luck that you have PCOS and there really isn't a treatment. And so I know that you get no response, or no, you're in the normal range, and here it's, this is where you need to be if you have this, and looking over my whole labs and history and treating to me, not to a normal range.
Yeah, there's nothing worse than feeling absolutely terrible until...
Yeah, you're 2 points into non-good.
One, a lot of the normal medical professionals are going off of ranges that can include an 80-year-old, right? Like, what normal is defined, yep, it's normal if you're 80 years old, type of thing, right? Yeah. So we're very much interested in taking your body back to more like where you were in your 20s or 30s, and you function like you're in your 20s or 30s.
Right. And that you feel like that, not just what your labs look like you're supposed to feel.
Yeah. So what would you tell a woman who was considering bioidentical hormones, doesn't know a lot about it? What advice would you give her?
Anyone who's struggling with their hormones, menopause, if you are not getting the answers, I would suggest at least to come in for the free consult, because they will listen and find out what is best for you as an individual, not as a demographic.
And our providers at Revitalize, we're not just looking at labs, although we do very, very thorough labs. We're also looking at the person and the symptoms and how you're feeling, and basically it's very individualized, our treatment plan. There's no.
And I like that they want to get you to where you want to feel. They're continually wanting, okay, where do you want to see improvement? So they care about how you feel and are determined to get there.
Perfect. Well, thank you so much for taking the time to do this.
You're welcome.
And hopefully this can help maybe some of those other women out there who are looking for the right place to
I hope to
check us out. So, okay, thank you.
Thank you.